It would be nice if you could trust that 100% of what a Medicare agent or broker tells you is true, but the truth is you need to do enough research to know when something being said just doesn't sound right. If you've seen my last two videos, you've seen some examples of what I'm talking about. Sure, some agents are motivated more by their paycheck than by your health care. But the truth is, many caring agents with the highest integrity simply don't fully understand Medicare and the insurance products that go with it. So this is part one of a two-part series on the lies and mistruths that you can hear coming from Medicare insurance brokers. In this video, I'm going to share with you 5 of those lies or mistruths that I've seen in my many years in the industry, seen repeatedly. And this video will focus on the lies and misinformation regarding Medicare Advantage plans. The next video, part 2, will reveal the same about Medicare supplement plans, plus a few things agents do but really shouldn't. So be sure to subscribe so you get that video when I publish it within the week. If you come across an agent that suggests some of these lies are true, you may wish to look elsewhere for advice. It's usually an indication of poor product knowledge, but it can be the result of other motivation. So here we go. If we haven't met yet, I'm Matthew Clausen, CEO of MedigapSeminars.org. We are one of the premier independent insurance brokerages in the country, helping people with their Medicare and retirement needs from coast to coast, plus Alaska and Hawaii. Our services are free to you, the consumer, and our goal is to help you make an informed decision regarding your Medicare. So, mistruth number 1. When presenting a Medicare Advantage plan, you will often hear an agent say that with a Medicare Advantage PPO, you can see any doctor that accepts Medicare, leading you to believe it's just like a Medicare supplement. Now, this is more often a lack of understanding of the product they're selling than intentional dishonesty. The truth is that with a PPO, you can ask a doctor that does not accept your insurance if they will accept that insurance just for you. They're not obligated in any way to do so. In fact, unless you have an existing relationship with that doctor, perhaps from previous insurance, they almost always say no. It doesn't cost anything for a doctor to sign a contract to accept an insurance plan. But many reject some insurance companies because they've had some bad experiences with that company in the past. According to Medicare, just over 9% of Medicare Advantage plan procedures are approved by an insurance company, followed by a denial of payment to the doctor. 9%. That's why you see doctors regularly changing the insurance they accept. They're running a business and can't have insurers that don't pay or delay pay for months. With a Medicare Advantage PPO, you can always ask an out-of-network doctor if they will accept your insurance, but they are under no obligation to accept your insurance and are likely to say no. Mistruth number 2. You may also hear an agent tell you the Medicare Advantage plans cover everything that original Medicare covers. This too can be said from ignorance, but is often just an agent ignoring the truth because it's uncomfortable. Medicare Advantage plans are required to cover health benefits from every category of health benefits covered by original Medicare. But that is not the same benefit. Physical therapy is my favorite example. If you have original Medicare and a supplement and your doctor orders 20 physical therapy sessions, you get 20 physical therapy sessions. No questions asked. If you have an Advantage plan, the doctor must submit their request to the insurance company for approval. Typically, the insurance company will either deny the request outright or amend it to something like 7 to 10 physical therapy sessions. Both types of health insurance cover physical therapy, the same benefit category, but it's not the same benefit. So this next mistruth is just pure baloney. It's a fabrication that can often be traced back to the insurance company, product propaganda, and inexperienced agents eating it up. But before I go there, you might be interested in this. Hi, I just wanted to take a moment to be sure you're aware of something that you may find helpful. If you're just researching Medicare and trying to figure out which plan is right for you, you may find my free Medicare mini course helpful. This is a 4-part course of short videos to help you understand Medicare so that you can make an informed decision. Just head on over to MedigapSeminars.org or click the link above my left shoulder and look for the talking head in the lower right of the screen. When you click on it and choose the free Medicare mini course, you'll be glad you did. Oh, and if you like this video so far, please help me out by pressing the like button and feel free to leave a comment or a question. So let's get back to the video. Okay, now let's take a look at a mistruth or lie that the insurance companies want you and their new agents to believe. Mistruth number 3. A Medicare Advantage plan is just as good as a supplement, but with extra benefits. We hear that a lot. First, a Medicare Advantage plan was never intended to compete with Original Medicare plus a supplement. It was intended to be a lower cost version of Original Medicare without a supplement. The promise to Congress by the insurance companies was that the Advantage plans would have the same benefits as Original Medicare and cost 10% less to the government, and that was in 1997. Now, the current Medicare Advantage plans have less coverage than Original Medicare's Part A and B because of the issues like the previous example with physical therapy, plus over 2 million cases of denial of service in a year. The denial of service is where the insurance company denies the doctor's pre-authorization request outright. And the cost to the government now is 10% more than Original Medicare, not including the billions of dollars of overcharges the government is trying to claw back from the insurance companies. By law, every Medicare Advantage plan is required to be the actuarial equivalent of Original Medicare without a supplement. That means that the average person on any Advantage plan should have about the same out-of-pocket medical expenses as a person on Original Medicare, which means half have fewer expenses, half have more. One easy way to tell that the health care itself is not as good as Original Medicare is to simply listen to a Medicare Advantage salesperson. Every Medicare Advantage plan salesperson and presentation I've listened to will brush over the health benefits and focus on the extras like dental and gym membership. I call them shiny objects. They sell the shiny objects, leaving you to assume your insurance coverage is the same as Original Medicare. Of course, you cannot get a Medicare supplement with an Advantage plan, so you can never make it as good or as much insurance as Original Medicare plus a supplement. So mistruth number 4. I'm surprised that I still hear this on occasion from agents. Medicare Advantage plans are free Medicare or cheaper than Medicare supplements. It's a low-cost way to get Medicare. Well, even Medicare stresses to agents in the annual required training that an agent should never claim a Medicare Advantage plan is free. It is not. There are some zero premium plans, but you must still pay the co-pays for doctor visits, co-insurance, deductibles, and so on. In fact, for 2024, your maximum potential out-of-pocket costs allowed for an Advantage plan is $8,850 if you follow the plan's rules and stay in network. If you go out of network, Medicare's maximum is $13,300. Of course, any unapproved medical treatment is 100% on you with no maximum limit. And to be fair, many Advantage plans choose to have a lower maximum out-of-pocket. But still, compared to that maximum out-of-pocket of just $240 when you have a supplement plan G, it's not as good. Advantage plans are not a lower cost than supplements. They simply divert your costs away from the plan premium to paying much more when you need health care. The Kaiser Family Foundation did a great study on this a couple years ago and found that over their lifetime, people with Medicare Advantage plans pay more for their health care than the combined cost of insurance premiums plus health care for those with a supplement plan. So let's move on to mistruth number 5. And I hear this a lot. I can avoid IRMAA with a Medicare Advantage plan. So I hear this all the time, and it's more from the public than from agents. And people will say, I wish I knew that I'd have to pay an extra IRMAA charge. I would have gone with an Advantage plan. Or I'm going with an Advantage plan because I have an IRMAA charge. The IRMAA surcharge is charged regardless of how you get your Medicare. The only way to avoid it is to have one of the 8 exceptions they allow on an appeal, or lower your income. For more information, I've got a great article and video on IRMAA, and I'll link it above my left shoulder here and in the show notes below. So that's it for part 1. Look for part 2 on Medicare supplement plans within the week. And please subscribe so you can be notified when it launches. So now it's your turn. I make these videos for you to help you make an informed decision. I hope you found this information helpful, so please like this video, press the thumbs up for me if you found the information useful, and leave me a comment or a question below and let me know what part of this video that you found most helpful. So when you do leave a comment and like and subscribe and all that, you're helping to spread this video so that people like you who are researching the same questions you had find this video. And if you want more, please do subscribe, and then you can see all my Medicare videos. I'm Matthew Clausen with Medigap Seminars. Thank you for watching.